Do you know if you have borderline personality disorder? And if so, how are you being treated for it? I know I have it, and I have other things as well, so it makes it super difficult to treat. Um, but I found an article that I'd like to read about the consequences of untreated borderline personality disorder that I would like to read. Um, so it's if left untreated, the mental health disorder can lead to a host of issues involving day-to-day relationships and dangerous health situations. Borderline personality disorder, sometimes called simply BPD, is a mental illness marked by mood swings and self-image issues that, if left untreated, can lead to impulsive behaviors and relationship troubles, among other serious health problems. According to the National Alliance on Mental Illness, BPD is most commonly diagnosed among women. It is also more common in people who have a history of childhood trauma or abuse. According to the National Institute of Mental Health, diagnosing BPD generally involves a mental health professional interviewing the patient to talk through the symptoms he or she is experiencing, as well as reviewing family medical histories. Symptoms of PBD can include interpersonal difficulties, intense and inappropriate anger, suicidal ideation, and fear of abandonment. And I understand all of this because I have it and it's very difficult. There's always a lot of junk. Difficulties diagnosing borderline personality disorder. Despite this list of specific symptoms, BPD can be tough to diagnose, just like other personality disorders. It's that's partly due to a lack of understanding. Personality disorders just aren't talked about often, and they can be confusing to some people, which leaves many people suffering from BPD without ever realizing they have it. And that's true. That is one that, you know, um, bipolar is so common, I guess, that you can talk about it because I've had it for years. And okay, I understand it. Um, PTSD, yeah, you know that's understandable completely. Um, ADD, ADHD, those you can understand as well. But borderline is very hard, and then they try to treat them the wrong way. Okay. Other times, a patient exhibiting the symptoms tied to BPD might be embarrassed to admit there's something going on. This is an illness that's really been stigmatized because it's a personality disorder. One problem is in the name. When you call it a personality disorder, it makes people assume it's not biologically driven. On the contrary, there there are biological underpinnings, underpinnings, genetics, brain structure, and a history of traumatic events all play a role in putting someone at risk of BPD. You have to understand these articles they are written by doctors and things like that, so it's like they're not everyday, it's not everyday language, it's, medical jargon. So forgive me for screwing up. I'm trying to get a point across, and it's not always easy when you are reading medical jargon. Finally, PBD is often misdiagnosed, usually as bipolar disorder, since there's some overlap of symptoms, primarily unstable moods, according to a 2010 study. And that's funny because in 2010 is when I was diagnosed with bipolar. And I'm not sure when I was diagnosed with borderline, but it wasn't that many years ago. And it can take as many as 5 interactions with the mental health system before PBD is identified as the root of the problem. So, in other words, they're diagnosing things wrong, and then we suffer. How to treat borderline personality disorder. The good news, I don't think it's that great, though, is receiving a borderline diagnosis can be a step toward healing. Borderline can absolutely be treated. People respond to treatment, both psychotherapy and medication. See, now they give somebody like me medication, and they're going to talk about it, an antidepressant. Well, when you have bipolar, you can't take antidepressants. So then you run into a problem here. He estimates that about 3/4 of borderline patients he's worked with have taken medication. Normally, medication is used to treat a co-occurring disorder. For example, an antidepressant might be prescribed to treat the depression that can go along with borderline. Psychotherapy, which is the first line treatment for borderline, can help address the other symptoms. Over the past 10 years, dialectical behavior therapy, a cognitive behavior treatment developed by Marsha Linehan, has become the gold standard in treating borderline. Sorry. But it won't. It's ones like these that I should print out. But it won't necessarily be easy. DBT, my God, DBT can involve up to a year or more of intense therapy, which usually includes 2.5 hours of group therapy each week plus one-on-one therapy sessions, as well as case management if necessary. Well, there's some people that don't do group therapy at all. We won't mention who. This type of therapy is primarily skills based. Those in treatment will learn how to handle different situations that come up by practicing mindfulness, tolerating distress, regulating emotions, and engaging with others effectively. If the diabolical, the DBT isn't successful for you, know that you have other psychotherapy options available. Other people may do well with good psychiatric management, while some may see success in transference-focused psychotherapy or mentalization based therapy. Now, you know, I have such trouble reading this stuff, but I'm doing my best and I'm trying to help you maybe get some answers, or maybe where to turn, maybe what to talk to your doctor about, such and such and so forth. What happens if borderline is left untreated? Maybe someone exhibits the signs of borderline but is not aware of the symptoms or actively decides not to seek treatment. Over the course of this person's life, he or she might experience the following: relationship troubles. People with borderline have a black and white view of the world. Things and people are either good or bad, and how someone with borderline
The dryer has finished running.
never fails. Someone with borderline is feeling can change almost instantly. Relationships in particular can be problematic. People with borderline commonly have a love-hate approach to others. Yeah. One day a person with borderline might view their partner, friend, or family member as the best person in the world. The next day, he or she might do a 180 and decide best that that best person in the world is now the worst. Happens. They have these ads in between, so I'm sorry for the delay. I've tried to fix it. Some of this can be traced back to the fact that people with borderline tend to fear abandonment. For instance, they might cut off communication with a loved one if they feel they're at risk of being left behind. This, of course, can lead to lots of interpersonal conflict and chronic difficulties with relationships. Hence, relationship turmoil, divorce, and trouble maintaining positive relationships with family and friends can be common among people suffering from borderline. Job loss. These interpersonal conflicts can also affect someone's ability to maintain a steady job, especially if they take that love-hate approach with their boss or coworkers. Yeah, that could be an issue. Their life is in disarray. The symptoms of borderline can be severe and debilitating to the point where being unable to regulate emotions can almost certainly wreck their life. What you begin to see is a life described as instability. But that doesn't mean everyone with borderline will fall into this this camp. There are some people with borderline who function quite well. I wouldn't say the diagnosis alone means someone might not be able to hold a job or get married if they wanted to. For example, Dr. Linehan mentioned above for her pioneering work in treatment of borderline has acknowledged having borderline herself. But should the relationship problems be severe, job loss could be the ultimate result. You know, sometimes I read this stuff and I'm like, who comes up with this? It doesn't make any sense. But I'm just walking us through it and hoping that we get some kind of information that's helpful. Why we do the things we do, why things are the way that they are. So hopefully we'll get something out of it. That's what I'm hoping for. Hospitalizations due to self-harm. Many people with borderline harm themselves, such as by cutting, to try to deal with their overwhelming feelings. Some may even attempt to take their own lives. I have numerous times, but they thought it was, um, this was years before I was diagnosed with anything. They just thought it was depression. So they were giving me antidepressants, which don't work with bipolar. So here I was taking pills that were not working. So finally I found a good doctor and I was on my way, and I still am, and I always will be, because I'm really bucky. If the therapist or anything, they say something I don't like, I question them, I buck the system, because it's my life and I want to live it a certain way. Um, and I guess I feel like they're telling me what to do, and I don't like being told what to do. But still, if they say do this, and depending upon whether or not I feel like that's the road I should take, that's up to me. So, suicide attempts are so common among people with borderline that they're considered a symptom of the disorder. Up to 10% of the people who qualify for having, really, we qualify for having borderline? I don't remember qualifying. Well, I don't remember signing up for it. Okay. People who qualify for having borderline die by suicide, which is 50%, which is 50 times the rate of the population as a whole. Generally, this self-destructive behavior starts up when a person's mood is down. That's where the self-mutilation comes in. The really impulsive behavior comes in. Suicidal thoughts that become overwhelming may lead a person with borderline to seek help through hospitalization or by entering an inpatient treatment center, according to the study. Now, I did that. I've done a 3-day voluntary hospital, and it didn't work out. And then I ended up in a 2.5 week involuntary hospital because I overdosed. So I've tried the system. Anyway, often this kind of behavior serves as a wake-up call for the person suffering. And that's what I was talking about. I did this, and I've had hospitalizations where I'm like, this is stupid, and, say, well, because the whole process of the hospitalization, it's group, a lot of it. I don't do group, so then I'd fail. Even though I wasn't being tested on it, but it wouldn't work for me because I don't do group. So, a wake-up call for the person suffering. For a lot of clients, the suicide attempt scares them and it wakes them up to how threatening this is to their life. That's kind of hilarious in a way. Let's see, I'm gonna attempt suicide. Oh, it didn't work. Now I'm awake that I'm gonna deal with this mental health issue that I have. Thanks a lot. It's just waking them up is just, it sounds like we're sleeping through this, and we can do something to wake up from it. It just is kind of irritating. Yes, you are on my channel, And yes, I do have my own opinions. And yes, I have been through this for a really long time. So I do have my own opinions. So if it helps you, fantastic. But reading this, I find it usually is a lot of bullshit. Um, and that's just how I feel, and you can feel how you'd like, and I'm okay with that too. So anyway, that just is hilarious. It wakes you up. Um, so anyway, a desire to engage in reckless behavior. Engaging in dangerous and reckless behavior is another complication of borderline. If left untreated, the person suffering from borderline may find themselves involved with extravagant spending, substance abuse, binge eating, reckless driving, and indiscriminate sex. Indiscriminate. Okay. That just sounds weird to me. Sorry. I don't know. But yeah, I did when I was single and they hadn't diagnosed me yet. I did all those things, drinking and driving and yeah, spending. I had a good time. Oh, I shouldn't admit that. The reckless behavior is usually linked to the poor self-image many struggling with. Patients struggle with. And I do. I don't think much of myself. I hate myself. I hate how I look. I hate that my fiance loves me because I feel like I don't deserve it. Um, because I have, I don't want to say a track record, but a past relationship that I felt like I wasn't loved. So then it makes you think that you're not loved or you can't be loved. How could I possibly be loved? They didn't love me. So, you think of that, um, the whole love thing. You feel like you're not worthy. Um, as a result of engaging in these dangerous activities, the person with by borderline will have to face the health and physical repercussions. For instance, binge eating can lead to serious health issues such as heart disease and blood sugar spikes, while sexually transmitted diseases or unplanned pregnancies can result from engaging in unsafe sex. Well, sure, you might have a mental illness, but that doesn't mean you're completely fucking stupid. That's how they're making it sound. Like you're so out of it. Well, maybe, well, okay, I'll take that back a little bit. Maybe you are so out of it that you have no control of what you're doing. But I would like to think that as an adult, you get the concept of safe sex. You get the concept of what you're doing. But I guess if you're that far out, maybe you don't. I guess everybody's different. I guess I'll leave it at that. And I try to understand and I try to make sense of this all, but some of it just sounds completely ridiculous, like you're a fucking moron. But maybe some people are, and that's okay. Wow. A general feeling of an unsteadiness. Living without treatment is like trying to walk on ice. That's how a person with borderline feels almost all the time, like they can just never get their footings. For instance, people with borderline can be preoccupied with the fear of abandonment, whether real or imagined. And in a sense, yeah, I still feel that way. Um, but yet, I guess I have some securities in my life that I don't feel abandoned. Um, I used to. But that was because other people treated me that way, not because of my borderline. It's because how I was treated. So it says whether real or imagined, mentioned earlier, or I don't know. They may also have a skewed view of reality and feel like they're cut off from themselves and viewing their body from the outside. Sometimes, yeah, I can say, I'll say I feel fat, or, and I'll criticize myself. Um, but it doesn't last. I am being treated, but not for borderline, because borderline cuts into my other um, issues that I have. So, bipolar and PTSD, and they kind of cross into each other. So maybe I'm just being treated for it. Maybe those other things take precedence to the borderline, to where we kind of don't pay any attention to it. Okay, other illnesses. According to the National Institute, people with borderline who decline treatment are at a risk of other medical issues and psychiatric diagnosis. About 10% of people with borderline, for example, also have bipolar 1 disorder, and another 10% have bipolar 2 disorder, according to a 2013 study. It may seem strange that having one condition means you'll likely have another, but this is common across where'd that go? Personality disorders. People with personality disorders are at an increased risk of having other anxiety, mood, and impulse control disorders, as well as issues with substance abuse. It's entirely possible for a person to have borderline as their primary diagnosis. Now, I don't think that's true. It may be that I had one and then I got that one, and now, and then they figured out that one. I don't know. Whatever. Finding hope. Borderline personality disorder symptoms may improve over time. Not all people with borderline will identify with these situations, and if they do, experiencing these chaotic, unstable life events may push them to seek treatment. Because it's so scary, it can really drive the people to change. There's also a chance that borderline symptoms will improve with time. Research shows that almost all mental health gets better. Well, I'm getting older and it ain't getting better. It's pretty much staying the same, or it's on a roller coaster of ups and downs and ups and downs. I know that's bipolar, but when you put in the depression and you do all that, yeah, it gets messy. In fact, according to a 2011 study, 85% of the study's 175 borderline patients were able to enter remission by the 10-year mark. Only about 11% of the study participants relapsed, though some of the social functioning issues remained. Now, see, don't get, I don't get remission. How do you know you're in remission? And how do you get there? I've had this for so long, and this was the first, not this one, but there's another article that I read about remission. Well, how do you get there and how do you know you're there? I guess my therapists are just too stupid to know. Huh. Why might this happen? Emotional dysregulation just changes with time. as your 30s, 40s, and 50s, hormones change, and some of that dysregulation sort sort of subsides. Well, I'm in my 50s and I don't see things going anywhere. So, I don't know, that was kind of interesting. Is kind of stupid. It kind of pissed me off because sometimes some things don't make sense, but I wanted to read it and see what it had to say. Um, 'Cause you never know. And my camera. Oh, what the hell? Oops. That ain't even good. Well, I can't get it straight. It's like it's gonna be crooked tonight. I'm in a crappy mood. It's my dad's birthday, and he's not here on this earth anymore to celebrate it, and for me to celebrate it with him. I'm still not feeling a whole lot great. Still feeling kind of cruddy. Why is this? It's just pissing me off. This is just fun now. I don't understand why it's not straight. Because I had it on half screen. I had it on half screen, and I know why. There we go. I had it on half screen, and the other screen was the article, so I could read it while I was on camera. I was going to do faceless, but I decided to do this because I did. Because I did. Oh, I guess I'm in kind of a goofy mood. I thought tomorrow was Thanksgiving, and it's not. Not that I care. Because I hate holidays. You know, and it's like, I just don't understand some things. Some things you read, and you just feel like they're full of shit. They're just telling you what they think you want to know. And I know this because I've been in therapy for 39 years. So I know that they just want you to believe the bullshit that they're feeding you. When you're in the hospital, what do they put in your food? It's not good. But, and I'm not trying to dissuade you from going to the hospital if you have to go to the hospital. That's not it. But I'm just in a funk. I just want to go downstairs and go on my treadmill. I've only been on it a couple times because the backs of my legs really hurt because I overdid it the first couple times. Because I'm trying to, besides get myself a little bit more in shape. I'm not in any means out of shape. But it's winter and you can't be outside. So you want to kind of be inside. And I don't know anymore. I know people don't really watch my videos a whole lot because probably because I'm boring. There we go. I just like having lights that are different color in here because it makes my mood better. So I try to do that. But you know, tell me how you feel. Tell me what you think. If you have borderline, that's something that I've done a lot of research, well, not a lot, but I've done research on, and it's still really confusing to me. I guess because I've been this way for so long that by them telling me I have it? No shit. You're not telling me anything I don't know. I thought it was just part of the borderline or the bipolar and just part of my personality and just part of who I am. Not anything out of the ordinary. I didn't know that I had a new diagnosis, that I had a new issue because it's the way that I am. Take me who I am, take me who I am, or shove it up your ass, kind of thing, you know? Um, it's the way it is. So I'd like to know um, what your experience is. Was it a aha moment when you were diagnosed? What kind of therapy do you have and go through? Do you go to group? Does it help? Um, things like that. Do you take medication? Do you have other mental illnesses? Um, things like that. I'm just curious to know what everybody else is going through because sometimes I feel like I'm an alien and I don't want to look like E.T. I want to be a cute alien. I I try to work through things with a sense of humor because that's the only way I know how. So I hope you have a great evening, a great day. I hope that article came in handy because for me, I was just like, I found a lot of bullshit in it, but that's just me. I'm very that way. Uh, I read something and I take it personally because I think they're full of it, but I guess it's probably articles in general. Maybe they're just generally speaking. But they had statistics in, and their statistics are stupid. It's just, I'm very critical of anything. I guess 39 years of listening to the shit that I've listened to, I'm a little skeptical. And because of my age, I'm a little bit hesitant to change. You know how they say old people are set in their ways. So anyway, you have a good evening, and I hope that this somehow helps because I don't know, it just drives me crazy. What are you gonna do?